Major concern, many people are finding they can save money on medical and dental procedures by hitting the road. But how far would you go to save as much as 80% off of the cost of surgery? News Channel 7's Erica Rayco joins us with a look at medical tourism.
A new group of tourists are packing their suitcases and heading to other countries, not for the travel, but for non-emergency medical and dental procedures. Why? It's all about the money.
No, I think you have to have an open mind.
Fonda Pulliam needed 2 crowns. A local dentist told her it would be at least $2,400, a price that made Fonda consider putting it off.
And I was really depressed because my husband wasn't working at the time. So I knew I had to do something.
Some research turned up Dr. Alberto Coto, who said he'd do the work for $750. The only problem? Dr. Coto was in Costa Rica.
So that was like a no-brainer. My next call was to JetBlue.
Fonda ran into no problems combining a vacation with a trip to the dentist. She had other work done and told her friends. So far, a couple dozen friends have visited Dr. Coto.
As a result of going there spread over about 2 years and 4 trips, we became friendly with the dentist, and he did something that I've never heard of a dentist doing before. He took us to dinner with his family twice, gave me a birthday party on my 80th birthday.
And more intricate procedures done in Costa Rica saved even more.
The procedure for the sinus lift 10 years ago was $15,000 in St. Petersburg. There, the doctor who did the sinus lift was $1,500.
We do works and treatments that takes like years or many months in the US and many visits. We are able to do it in 5 days.
If you're questioning the safety and risks involved, you're not alone.
Somebody will have something done and then come back and have a problem and no one to go back to see. So that in lies many of the problems that we come across.
But Dr. Coto says that's not a deal breaker.
We have a 100% warranty, so if something happened to the patient, we will invite the patient to come back here as soon as possible, and he doesn't have to pay anything.
Americans believe that doctors in the United States have better training and equipment.
The Board of Dentistry, especially to practice in the state of Florida, you know, you go through a certified dental school and pass your board examinations in order to practice here. They don't have the same standards that we have in the United States.
But Dr. Coto went to the University of Miami and did his residency at Jackson Memorial Hospital in Miami. He says his equipment is equivalent to what's used here.
The equipment is the same. We have digital x-rays. We have top of the line in the technology.
Still, the American Dental Association says if you're considering medical tourism, you should carefully research the doctor and locale. For many medical tourists, though, there's an overriding concern.
Our cost has been about 40% of what it would have been here in Panama City. Local dentists don't like to hear that, and I can understand that. But that is a fact of life, and many things are cheaper outside of the United States, and dental work is one of them.
Experts say the most popular destinations for medical tourism are Costa Rica, Turkey, and Thailand. Other hotspots are India and Saudi Arabia. Of course, the higher the cost of the procedure in the United States, the more money that can be saved by taking it offshore. For example, heart bypass surgery in the southeastern U.S. can be about $144,000. In Thailand, it's about $22,000. Erica Rayco, News Channel 7.
Many insurance agencies work with employers to cut rates for health insurance if their employees agree to take the overseas option for non-emergency surgery.